Hello, my name is Steve Milstead, and I am going to be your presenter today for garbing and hand hygiene and cleaning of controlled environments. Currently, at the timing of this recording, I am the Parental Operations and Hazardous Drug Coordinator at Grandview Medical Center in Birmingham, Alabama, and the founder of Soigner Universal, doing business as Soigner Solutions. Now that we've just discussed how to keep the environment safe from us through the use of PPE and hand hygiene, we want to move on and talk about the maintenance of the controlled environment through cleaning. The important thing here is to know your processes and to know your products. When we talk about cleaning and disinfection processes, we want to understand some terminology. We want to understand that cleaning and disinfection are two very separate tasks, but understand that there are one-step disinfectant cleaners or disinfectant sporicidal cleaners on the market today that help streamline cleaning processes. First, let's discuss cleaning. Cleaning is the use of an agent that contains a surfactant in order to remove dirt, debris, microbes, residual drugs, or chemicals, but using some sort of mechanical process such as wiping. Disinfection, however, is the use of an EPA-registered disinfectant in order to destroy fungus, viruses, or bacteria. We talk about sporicidal disinfection by using a disinfecting agent that is effective for destroying spores. Spores are how some microbes protect themselves from harsh environments in order to survive until conditions become favorable. Now, the disinfection process, with or without sporicidal activity, we have to introduce an important concept called dwell time. The dwell time is the amount of time that a surface must remain wet in order for a product to do its stated claim. The dwell time for any given product will be found within the manufacturer's information. So that leaves us with sterile IPA, or isopropyl alcohol. Although never really the intent, many may remember that IPA used to be one and only product that we ever used to clean IV rooms. Although sterile IPA 70% does have broad spectrum activity against microbes, it's not effective for all microbes and does nothing for spores. Spores can actually live in IPA. Also, the dwell time can range from minutes to hours, depending on what we're trying to target. Additionally, it can't be considered a cleaning agent since it is not a surfactant. So what is sterile IPA 70% used for? As mentioned, it does destroy microbes, so it helps keep microbial growth under control during the compounding day as long as other cleaning agents have been in use. But really what we look to IPA to now is more of a residue removal product, to remove residues left behind from our cleaning agents. It's important to mention that sterile IPA cannot be substituted for non-sterile IPA. We've already touched on the reason for this. Spores can actually live inside IPA. Therefore, a bottle of IPA contaminated with spores could introduce spores throughout the compounding environment and cause microbial contamination. So now we're going to move on and talk about the frequency of which we are going to clean and disinfect the primary engineering control, or PEC. For cleaning and disinfecting inside the PEC, we're going to only use sterile cleaning agents and wipers. We will clean and disinfect the entire interior of the PEC, the ceiling, walls, work surface, etc., daily on days when compounding occurs and if there's any known or suspected contamination. Then, after that, we follow up by using IPA 70%, isopropyl alcohol 70%, to remove any residues left behind by the cleaning agents. A sporicidal disinfectant will be used at a minimum on the entire interior of the PEC monthly for Category 1 and 2, and weekly for Category 3 compounding. IPA will also be used on the work surface prior to initiating compounding and every 30 minutes during the compounding process. However, if compounding takes longer than 30 minutes, compounding will not be interrupted, but instead, once compounding is finished, the work surface will be disinfected, followed by IPA to remove residues. Next up is the actual technique used to clean the interior of the PEC. This is going to be highly dependent on the airflow and the location of the HEPA filter. Some key items to remember during this portion of the presentation is to never spray directly into the HEPA filter. The best practice would be to pour a cleaning agent onto a wiper or use a pre-saturated wipe. Also, remember that only sterile cleaning agents and wipers are allowed inside the PEC. If you have any tools that must be used to assist in cleaning the interior of the PEC, those tools must be clean and disinfected prior to use. For cleaning and disinfecting a horizontal airflow PEC, or primary engineering control, where the air is flowing horizontally out into the surrounding environment, the desired process would be to use one saturated sterile wiper per surface and start from the top, moving down to the bottom and working from the interior of the PEC and moving outwardly away from HEPA-filtered air using overlapping strokes. Also, it's extremely important to ensure that the sterile cleaning and disinfecting agent remains wet on the surface for the manufacturer's specific dwell time. Then, sterile IPA 70% will be used in the same fashion to remove residues left behind by the cleaning and disinfecting agents. As an example, start at the back corner of the ceiling and move side to side using overlapping strokes and moving outward away from HEPA-filtered air. Then, with a new saturated wiper, clean the covering over the HEPA filter. Starting at the interior upper corner of the back of the PEC, move side to side using overlapping strokes and moving down into the work surface. To avoid damaging the HEPA filter, do not apply too much pressure to the HEPA filter cover. If a bar and hooks are present in the PEC, they can be done next. Each sidewall will be done next using a new saturated wiper for each side. Start in the upper corner of the wall and move down and out away from HEPA-filtered air using overlapping strokes. The opposite wall will be done in the same fashion. Finally, the work surface is cleaned by starting in the back corner and moving side to side and moving away from HEPA-filtered air using overlapping strokes. For cleaning and disinfecting a vertical airflow PEC where the air is blowing from the ceiling down to the work surface, start at the top and move to the bottom and move away from HEPA-filtered air using overlapping strokes. There are a couple accepted ways to do this. Option 1 is acceptable, but used more frequently when we clean a biological safety cabinet. We'll go over this in more detail when we discuss it in the hazardous drug module. As you can see, the order is the same as previously discussed, starting with the ceiling, then the back, then the walls, then the work surface. The difference is the wiping action applied into the walls in step 3. In step 3, the motion is moving back to front, back again, and moving downwardly with overlapping strokes. The problem with using this option in an open-air laminar airflow PEC is that when you move from the interior of the PEC to the exterior and back again, there's the potential for taking back contamination into the PEC. Option 2 is a more accepted method for cleaning an open vertical laminar airflow PEC. Again, the order of cleaning is the same, with the ceiling, then the back, then the walls, and finally the work surface. However, the walls in step 3 are wiped using a unilateral downward stroke starting from the back of the PEC and moving outward with each overlapping stroke. Now that we understand the technique and frequency to clean PECs, we will review the technique and frequency for clean secondary engineering controls, or SECs. SECs are the rooms of your compounding area, the anteroom, buffer room, or segregated compounding area. For Category 1, the segregated compounding area, and Category 2 compounding, daily cleaning will be performed on days when compounding occurs and will include the PEC, the equipment inside the PEC, pass-throughs, work areas around the PEC, the sink, garbing bench, and floors. Also to be included in daily cleaning is any other high-touched area. Monthly cleaning for Category 1 and 2 compounding will occur monthly with a sporicidal disinfectant and include the ceilings, the walls, all daily cleaning just mentioned, along with the shelves, storage bins, equipment, wheels on carts and chairs, etc. Everything will be cleaned inside the room. Note, for Category 1, the segregated compounding area, the ceilings are only required to be cleaned when visibly soiled or if there's known or suspected contamination. For Category 3 compounding, daily cleaning is the same as previously mentioned. However, a weekly cleaning is introduced that includes the use of a sporicidal disinfectant to the daily cleaning process. Monthly cleaning for Category 3 will be the same as Category 2 using a sporicidal agent. The technique used in cleaning compounding rooms is the same as a PEC. We start at the cleanest point at the top, moving to the bottom and moving outwardly to dirtier areas. Therefore, cleaning a buffer room will occur first, followed by the anteroom. The exception to this is a negative pressure buffer room. All negative pressure areas will be cleaned last. A designated mop that has been cleaned and disinfected with a sporicidal agent will be used to clean the ceilings and the walls and the floors. The same mop for the buffer room can be used for the anteroom as long as the buffer room is cleaned first. Again, the exception is for a negative pressure buffer room. A designated mop should be used for a negative pressure environment. Removing residues left behind from cleaning agents is important and, if not done, can lead to microbial contamination of your compounding area. As discussed, when cleaning and disinfecting PECs, sterile IPA 70% is used routinely right after to remove residues left behind by the cleaning agent. This also must be taken into consideration for all other areas that are cleaned and disinfected. However, the use of sterile IPA 70% throughout the compounding day to help maintain microbial control also removes residues from these surfaces. The surfaces that lack attention on a regular basis are floors. It will be necessary to remove residues from floors on a regular basis. If not done, the floors will become sticky like a tacky mat and collect dirt and microbial growth, essentially introducing microbial contamination to your environment. The frequency at which residues should be removed from floors will be different from facility to facility, depending on the product used, frequency of their use, amount of usage, among other aspects. The facility will need to assess the frequency for floor residue removal and when that should occur. Ceilings and walls should also be assessed, but can usually go longer since they are normally cleaned monthly. As mentioned, sterile IPA 70% is an excellent source for removing residues, but may not be ideal for all types of floors and can lead to damage if overused. Use of IPA 70% on floors should be reserved for more challenging buildup and removal. For surfaces not compatible with IPA, such as floors, the gold standard for residue removal is sterile water for injection or irrigation. Sterile water can be allowed to sit on the floor and help dissolve the residues and then dry wiped. This will be the most effective way for removal of residues. So we talked about how cleaning, garbing, and hand hygiene helps protect our compounding environments from exceeding microbial levels, but we want to address the importance of introducing components stored in an uncontrolled space into our clean rooms. We have to remember that USP sets a minimum standard. USP says that prior to introducing a component into the compounding area, that it must be cleaned with either a sporicidal disinfectant, an EPA registered disinfectant, or sterile IPA. Although this minimum standard gives us a choice of cleaning agent to use, we have to be aware of our surroundings. Components can come from unkept totes that could have anything and everything present on them, and corrugated boxes are known to house spores and funguses. Therefore, anything coming from an uncontrolled environment to the controlled environment of the compounding area should be cleaned and disinfected with a sporicidal disinfectant. Then, in an ideal situation, the component can be wiped down with sterile IPA and introduced into the PEC for compounding. However, if the product is introduced into the anteroom and sits for some unspecified amount of time, it should be wiped down again with something, at a minimum sterile IPA, prior to being taken into the buffer room, but then wiped down again with IPA prior to being introduced into the PEC. Cleaning and disinfecting compounding areas are important for sterile compounding, as we've discussed in previous modules. However, for sterile compounding of hazardous drugs, we have to introduce deactivation and decontamination. Next, we'll go over this process. Just like in the non-hazardous module, we're going to go over some definitions. Some new and some that were introduced previously. Deactivation is the rendering of a drug or a chemical inert or inactive, often by using a product that's an oxidizer, a peroxide, or sodium hypochlorite. Not all chemicals have a known deactivation, or if you are a high-volume hazardous drug compounder, it may not even be feasible to carry every deactivation product needed. Therefore, if deactivation is not possible, the goal is to focus on decontamination. Decontamination is the removal of hazardous drug residues with an effective product using a mechanical wiping. Products used may contain alcohol or water, peroxide, or sodium hypochlorite. As mentioned in the cleaning module, cleaning uses a mechanical wiping process with the use of a product, usually containing a surfactant, to remove dirt, debris, microbes, or residual drugs and chemicals. Disinfection is the use of a EPA-registered disinfectant to destroy microorganisms. A sporicidal disinfectant will destroy organisms, including spores. And again, sterile IPA 70% is mainly used to remove residues left behind by the cleaning agents. However, keep in mind that sterile IPA does play a role in maintaining microbial control over the compounding environment, since it does have broad spectrum against microbes, but the dwell time can be lengthy and it's not effective against all microbes, so it can't be used on its own. And as mentioned before, there are one-step products on the market that help streamline the deactivation, decontamination, cleaning, and disinfection process. We'll go over the frequency and the technique for deactivation, decontamination, cleaning, and disinfection of the C-PEC. As we've discussed previously, remember only sterile cleaning agents and wipers can be used in an ISO 5 C-PEC. During a regular workflow working inside the C-PEC, the work surface will be decontaminated between different hazardous drugs. The C-PEC will be decontaminated, cleaned, and disinfected at least daily on days when used or after spills or suspected contamination. Monthly, the entire C-PEC, including underneath the work surface tray, will be deactivated, decontaminated, cleaned, and disinfected with a sporicidal disinfectant. Remember that Category 3, a sporicidal, will be used weekly, but for Category 1 and 2, the minimum requirement is monthly. It's important to understand that the process of cleaning underneath the work surface tray is disruptive to airflow and potentially exposes the worker to hazardous contamination. Therefore, a PAPR or full-face chemical cartridge mask should be worn during this process. Also, it's a good idea to clean the entire C-PEC prior to accessing the tray to decrease potential exposure. Once the underside of the tray is done and put back into place, the entire C-PEC can be cleaned again to ensure removal of any hazardous drugs or microbial cross-contamination from the break and airflow. As always, sterile IPA 70% will be used after to remove cleaning agent residues. One additional note for deactivation, decontamination, cleaning, disinfection of the C-PEC. Best practice would be to apply 2 applications of a one-step product. The first application would be for deactivation, decontamination, and cleaning. The second application will be for disinfection, and therefore the dwell time must be observed during this step. As an example for technique, start in the back corner of the ceiling and move side to side using overlapping strokes moving outward. Then, using a new saturated wiper, start in the interior upper corner at the back of the C-PEC, moving side to side using overlapping strokes and moving down to the work surface. If a bar and hooks are present in the C-PEC, they can be done next. Each sidewall will be done next using a new saturated wiper to each side. Start in the upper corner of a wall and move side to side using overlapping strokes and moving down to the work surface. The opposite wall will be done in the same fashion. Next, using a new saturated wiper, start in the inside upper corner of the sash and move side to side and move down with overlapping strokes. Finally, the work surface is cleaned by starting in the back corner and moving side to side and moving out using overlapping strokes. Now that we understand the technique and frequency to decontaminate and clean a C-PEC, we will review the technique and frequency for cleaning containment secondary engineering controls, or CSECs. All areas where hazardous drugs are handled must be deactivated, decontaminated, and cleaned. And for sterile compounding, must also be disinfected. For cleaning and disinfection of a CSEC for sterile compounding of hazardous drugs, we refer back to the discussions on USP 797 from our previous modules. So let's do a quick review on the cleaning process for sterile compounding with the intent of using a one-step agent that will also work to deactivate and or decontaminate the area. For Category 1, the containment segregated compounding area, and Category 2, compounding, daily cleaning must be performed on days when compounding occurs and will include the C-PEC, equipment inside the C-PEC, pass-throughs, work areas around the C-PEC, the sink, garbing bench, and floors. To also be included in daily cleaning is any other high-touched area. Monthly cleaning for Category 1 and 2 compounding will occur monthly with the sporicidal disinfectant and include the ceiling, walls, all daily cleaning just mentioned, along with shelves, storage bins, equipment, wheels on carts, chairs, etc. Everything in the room will be cleaned. Note for Category 1, the CSCA, the ceiling is only required to be cleaned when they are visibly soiled or if there's known or suspected contamination. For Category 3 compounding, daily cleaning is the same as previously mentioned. However, a weekly cleaning is introduced that includes the use of a sporicidal disinfectant to the daily cleaning process. Monthly cleaning for Category 3 will be the same as Category 2 using a sporicidal agent. The technique used in cleaning compounding rooms is the same as the C-PEC. We start at the cleanest point at the top, going to the bottom and moving outward to dirtier areas. Remember, as mentioned in the cleaning module, negative pressure buffer rooms will be cleaned last due to the dynamics of negative pressure drawing air in from the adjacent environment. A designated mop for the negative pressure buffer room that has been cleaned and disinfected with a sporicidal agent will be used to clean ceilings, walls, and floors. It can't be iterated enough that USP 800 is about all aspects of handling hazardous drugs in order to decrease exposure to employees in non-hazardous areas, keeping potential contamination contained within negative pressure environments. Therefore, we'll discuss a few techniques that should be employed during routine handling of hazardous drugs to help mitigate contamination. Prior to compounding, garb per the facility SOPs for sterile compounding of hazardous drugs using the appropriate PPE. In preparation, ensure that all components are gathered and disinfected, and if an IV bag is used, prime the line prior to compounding, or follow the facility SOPs. For compounding, a closed system transfer device or CSTD isn't required, but is strongly suggested since the end user is required to use a CSTD for administration of an antineoplastic from Table 1 of NIOSH if the dosage form allows. Therefore, giving the end user what is needed is an important aspect of successful containment processes. Additionally, the use of a CSTD during compounding exponentially decreases the contamination inside the C-PEC, therefore decreasing potential of exposure after compounding is complete. A CSTD should be needleless and have a protective measure to contain droplets and gases. It's also important to do research on a CSTD to ensure compatibility with the drug in the CSTD, since some antineoplastic drugs can be corrosive in nature. If a CSTD isn't used or cannot be used during compounding, a negative pressure technique should be employed during manipulation. This is done by never injecting air into the hazardous drug container, and when adding volume to a container, remember to remove air prior to withdrawing the needle. When compounding is complete, deactivate and decontaminate the preparation container, remove the outer pair of gloves inside the C-PEC, and discard in a sealable waste bag that's kept inside the C-PEC. Deactivate and decontaminate the final preparation container again, then remove it from the C-PEC and place it in a sealable hazardous drug containment bag for delivery. Doffing garb is an important containment strategy to mitigate contamination. When doffing, remember that outer gloves must be doffed inside the C-PEC, and if sleeve covers are used, they must also be doffed inside the C-PEC. Outer shoe covers must be doffed prior to exiting the C-SEC. All other garb used during compounding, for example the gown, should be doffed prior to exiting the C-SEC. This is something that will need to be defined by your facility. If your facility requires doffing of a gown prior to exiting a negative pressure buffer room, Then donning 2 pairs of gowns will be required initially so that at no time the compounder is in the buffer room without garb. Then, always remember, hands must be washed after doffing from compounding of hazardous drugs. Upon receiving a hazardous drug from your supplier, deactivate and decontaminate it prior to placing it in storage. The photo in the red on the right is a photo of an anti-neoplastic drug with visible contamination. Often, contamination cannot be seen but still there. Therefore, it's necessary to deactivate and decontaminate a hazardous drug container upon receipt and before placing it in storage. Remember that if you're using a hazardous drug negative pressure buffer room to store your hazardous drugs, then you must also disinfect the container prior to storage. When compounding, it's important to deactivate and decontaminate the container of the final preparation twice. Once prior to removing the outer pair of gloves and once after to reduce potential cross-contamination during the removal process. Always place the final preparation in a sealable hazardous drug containment bag for delivery in case there is leakage or breakage. Again, when delivering a hazardous drug preparation, ensure that it's in a sealable hazardous drug containment bag and wear ASTM-rated gloves during transport. Note the photo in the yellow on the right. This is an example of betadine injected into a PVC bag and set on white paper. After some time, the paper turns black, showing that chemicals can, in fact, move across the barrier of the final preparation container. Remember to always carry a hazardous drug spill kit during transport in event of breakage. In closing, remember that USP 800 covers all aspects of handling hazardous drugs, from receipt, storage, compounding, sterile and non-sterile, delivery and transport, administration, and waste. It's important to have all areas covered to keep those who handle hazardous drugs safe. An assessment of risk is an important concept of USP 800. The only drugs that must always follow full containment are hazardous drug APIs and anti-neoplastic drugs on Table 1 of the NIOSH list that require manipulation. All other drugs can be released from full containment if an assessment of risk is done with a documented alternative handling process in place. If a facility chooses not to employ an assessment of risk process, then all hazardous drugs must follow full containment of USP 800. This concludes the presentation for this module for garbing, hand hygiene, and cleaning of controlled environments.